Yeah.
What's the conversation with patients around things like clinical trials? I know we mentioned a little bit before, like distrust, mistrust of the medical system. Are you talking to patients about clinical trials? Are they aware of clinical trials at all? Are they asking to be included in clinical trials? What's that
Yeah.
like?
So I think this is where we need a lot of work done because they most times do not voluntarily ask about clinical trials. And sometimes when I introduce clinical trials, it's met with skepticism and a lot of questions. And yeah,
Mm.
so I do think that more work needs to be done in that area to get the underrepresented groups
Mm.
of patients involved in clinical trials.
What do you think is a potential kind of area of improvement or change in approach or strategy when it comes to actually helping people be more interested in clinical trials that are historically underrepresented? Is there anything that you see that might be a way to
Hmm.
bridge that gap a little bit?
Yeah, so just to educate, that's key. That's really important to explain that how I do it normally. I would say, well, all the treatments that we offer today are as a result of clinical trials. And I think that you'll get the opportunity to be a part of such a study that will not just help you, but subsequent generations of patients. And yeah, and basically I take it from there. And most times that works. Yeah.
Interesting. Um, for the clinicians listening, what is one change they could make in their practice this year that would
Hmm.
meaningfully improve care for people with or at risk for breast cancer? What would you say is just one thing that you would want clinicians to improve on?
Yes, before a diagnosis of breast cancer. Yeah, so I would say to educate your family members, friends, to about the importance of getting their screening mammograms. Now the age is reduced to 40, at which women can start receiving their breast cancer screenings with mammograms, and that should be covered by all insurance or most, if not all, insurance. So I think that's where we should start, just educating. Yeah.
When it comes to navigating the mental health aspect of it, what do you think are some of the biggest areas of support for patients, or what do you wish existed for more patients as far as options on kind of the mental aspect of going through this process?
Yeah, so that's a big one. So we have like palliative care, supportive care services where patients are counseled and are assisted with adjusting to their new diagnosis. We have a separate mental health psychotherapy service as well. But I do believe that the need is great and we can do better in that regard.